Okay. Um, I'd like to say good afternoon, good morning, depending on the zones that we're all tuning in. My name is Dapo Olonriyomi, and I lead the Center, Premium Time Center for Investigative Journalism here. I have just 1 or 2 minutes to give a sense of what we do at the center and then hand all the processes to uh, the great Mojisola Makojola. Um, as those of us in Nigeria know full well, the center is a journalism innovation and development entity. We try as much as possible to help build the capacity of journalists to report issues in a way that will bring greater impact. We're in a very fast changing world, and a whole lot of the ecosystem, both in terms of subject matter, in terms of the technologies that impact our work, everything is changing, and that's the intersection we find ourselves. For today, of course, the idea is to then bring the pandemic and the debates around it to some kind of consideration in our own country. And I think we cannot be luckier. Uh, and we are to have discussed five-star, some of the greatest minds on the subjects. I'll let Moji do the introduction in a short while, but I just want to say, by way of welcoming you all, to say a great thank you. Dr. Corey, I know we were chasing you all around the world, and we're so grateful that this is something that you can do. My great friend, Mia, thank you. Absolutely grateful to Dr. Obasan, yeah, from the West African Health Organization. And it's great that we can have a West African perspective. Thank you so very much, sir. And last but not the least, the man that we all will certainly need to provide the best thought and intelligence on how this is happening in our own country, Dr. Bulama Garba. We're very grateful for your presence here today. Um, Not to waste people's time, I'll quickly hand over to those of you who are familiar with great television in Nigeria will have no difficulty in remembering the age of Mojima Konjola in Nigerian television. So at this point, I'll hand over everything to my great sister, uh, my super fan that I am of your work. Thank you so much. Over to Moji Makonjola. Thank you and welcome.
So very much, Dapo. And should I say on behalf of all of us who are so interested in ensuring that we are able to speak truth to power, considering what the world is witnessing today, and which we all have coined COVID-19. I would not want to waste any of our time because there's so much to speak, especially to speak to, especially in the face of uh, uh, um, all kinds of theories, conspiracy theories, perceptions, misinformation, infodemics, and the rest of it all put together. But I'm very excited to be here with all of us today and hope that we would, when we kick off with this conversation, it will be something that will broaden understanding and enlightenment of where we have found ourselves today. The coronavirus disease of 2019 pandemic came as a root shock to the world, and we are still grappling the best way to treat it. By the way, I'm the only one in my office, so I'm very COVID protocol. I'm doing just that, so I don't have to wear my mask. I've taken my first COVID-19 immunization, so I cannot infect you virtually. So you're all safe with me without my mask. So let's go on, let's get it done with. Well, I do the agenda I have here, and are you going to share the agenda, please, on the screen? If you can hear me, can you please share the agenda on the screen? Well, because I can't see Dr. Garba Bulama, who should actually kickstart this to give us a perspective of where we are as a country. But I can see that Pierre Corey is here. A very good afternoon, and thank you for sharing your time with us. Joshua, I can see you online, Dr. Joshua Obasoya. Please, can I see your face to be sure that you're there? Good to see you. And well, we also have Deji Adekule there, and of course, Mia, are you there? Mia?
Yes, I am here.
Fantastic.
Video. I'm
all
here.
right. Yes, good to see you. So I think we're all set to roll. Apparently, the panel discussion should actually start with, I think, is Adedeji Adekule there? Adedeji.
Yes, I'm
okay.
here.
Okay, right. I will just grant the floor to you for another 3-4 minutes, so that we can actually understand the concept of what is bringing us all together here today. So Adedeji, you have the floor now.
All right, thank you. I'll have to share my screen. So give me a second, please. All right. Good. Once again, permit me to stand on all prior protocols and say that it's really a pleasure to be here and to talk about one of the initiatives of the PTCIJ that has had to face the COVID pandemic head on as one of the, I'd say, first responders, especially in the media space. So to introduce myself, Deji Adekunle, I'm the Deputy Program Director of the PTCIJ. I also lead our DUBA project, which is our intervention to combat information disorder in the West African sub-region. And DUBA, there's a website, DUBA, that really interfaces with misinformation and disinformation. And it played a very, very huge part and still is playing a huge part in the pandemic. I remember the WHO coined the phrase infodemic to express the deluge of misinformation and disinformation going around and the adverse effects it has. So DUBA is a regional project present in Nigeria, Ghana, and Sierra Leone. So basically, from our point of view, dealing with the information overload, these are the issues. The first, of course, like I said, information overload, because of the tech age, because of the disruption of social media, there's a lot of information flying around at the same time, and people have changed their consumption patterns. And this also presented a problem, or a challenge rather, for health organizations at all scales, globally and locally, because scientists and healthcare professionals had to learn how to communicate in a fast-paced world while they are trying to communicate issues that require a high level of accuracy and care, especially when it has to do with lives, who dies, and matters of general well-being. So that's is a challenge that is still being addressed. However, all citizens of the globe like to see their timelines and like to see news and like to see information on what's going on. And that gap presented an opportunity for people to feel, to provide their own version of events. And that is what created a dealing with generally. So there's a general lack of reliable and verifiable information. Now, looking at the scope and nature of claims, because since last year, we've had to dedicate a lot of personal or internal resources to combating the infodemic, so as we like to say here. And about things that we had to fact check, with symptoms, had to do with issues, how to use your face mask, what face masks are safe or not. Plenty cures, fake cures being announced by individuals. And then more recently, the conspiracy about vaccine being used to depopulate African countries. Also about a lot of fake videos and photos about people reacting to the vaccines, and then vaccine distribution and logistics. There was a recent story that filled the media space about Nigeria being disqualified by the WHO from getting the vaccine. However, that was false, and we put a debunk to it. We also see in the behavior of the people, we also had to study that, and we see that it's not really too unique to the countries. You see claims start from Asia, start from Europe, and end up in Africa, or start from Africa and end up in Europe. So there's a distribution of claims, sometimes recycling of old claims. And of course, like the grand conspiracies like the 5G conspiracy and the pandemic, which was a very big thing, especially in the US last year. And what makes this very, very difficult to deal with is the mixture of true and false information in most of these contents, media content. And so people really did not know what to believe. And that led to consequences, general consequences, which we can see around us, like the blatant denial of existence of COVID in some individuals and even highly placed officials in different governments around the world. The general vaccine hesitancy that we can see, and of course, the direct personal health risk everyone faces due to false information. And consequence of such acts of misinformation, especially health related, is more than just COVID. We've seen it play out in Ebola and many other public health crises around the world. And this is an opportunity to get communication right and stem the information disorder problem in the future. Now, our approach as DUBA, our primary approach based on our primary competencies was to write fact checks, which is basically debunking or verifying claims, and explainers, which is a more elaborate response to health information. And all of these were driven by expert opinion and rigorous scrutiny. And then we also had to experiment due to the speedy nature of misinformation and the reach. We had to try different distribution formats, use multimedia, try to create some indigenous language projects, and distribute on all social media platforms that we could. And then also in the background, we're doing a lot of research, trying to predict, trying to understand the behavioral patterns of consumption and use of information by the public through our IDAC project called the Information Disorder Analysis Center, which is a project of the DUBA team. And secondary, of course, and more importantly to me, is the collaboration, the need for collaboration. A few organizations who've collaborated are here. We were part of the starting members of the Coronavirus Fact-Checking Alliance, organized by the International Fact-Checking Network. And it's also still going on. And we've also been we are also a part of the Africa Infodemic Response Alliance, which is supported by the WHO, or led actually by the WHO, and it's a cross-continental and cross-organizational project. And we've also worked with government agencies. We've worked with the National Commission for civic education in Ghana. We've provided capacity building for them, and we're about to do the same here in Nigeria, the National Orientation Agency. We've partnered with the NCDC, especially last year, and we believe collaboration is really the way to go, and we're opening to do a lot more. And we've worked with other CSOs like AFAWI, and this is just to mention a few. So we believe this is just the start, and these are just a few thoughts and experiences shared from what we've had to deal with as an organization with regard to COVID-19, and of course, the present issue we're going to discuss here in the panels later on. Thank you very, very much. You can reach us on these platforms, on WhatsApp, on social media, or just start at www.dubawa.org. Thank you very much. I'd like to hand over to our lovely narrator here. Hello, Ma, you're muted.
Okay, all right, I'm back. Thank you. Thank you very much, Adedeji Adekule, for that insight. Very important that we know where we're going and what exactly we're aiming to do today. And I thought, going by the agenda, that our publisher, my brother Dapo Oloriemi, will be back, but I think he did everything together at the very beginning, so we won't go back to introduction of the moderator. My name is Mojima Kojola. I just address myself as a health correspondent. That's a development journalist who is working to still now, haven't done a lot on television. So I do a lot of advocacy, health messaging, health communication with my team at the International Society of Media in Public Health. So without wasting any more time, I think we should just go on straight to the conversation. On the agenda that I have here with me, we should expect that the Dr. Faisal Shuaib, Executive Director of the National Primary Healthcare Development Agency, should be the one to speak on vaccine distribution and challenges in Nigeria. But I know that Dr. Abdullahi Bulama Garba is standing in for him. Yes, it's good, I can see you now. And I'll just quickly introduce this young, energetic man that I have worked with. At least I've worked with you in the last 12, 15 years, Dr. Bulama. We were together when we were trying to eradicate polio. 20 years. Thank you. 2000. Thank you, 20 years. Wow, how time flies. Dr. Abdullahi Bulama Garba is very, I treat him very specially because here's a guy that came on from the street to become the expert that he is today. We have what you call the Al-Majri system in Nigeria, where you just allow children to go and live and beg on their own while trying to learn Islam. And he grew up from that hapless situation to become the expert that he is today. And I always like to showcase him as one who has the can-do spirit. Now, he's professional trained in public health with more than 9 years of experience in immunization practices, worked in 84 local government areas in 32 states of the Federation from the year 2000 to date. He was at one time medical officer in charge of the epidemiology unit of Ahmadu Bello University Teaching Hospital in Zaria from 1996 to 1997. He has led several advocacy visits, and that's where our paths crossed, which has brought about positive changes in the lives of people, particularly those who reside at the local level, with emphasis on promoting the importance of immunization, especially polio eradication initiative in Nigeria. And today, Nigeria has been certified polio-free. Are we working towards COVID-free environment? Well, for whatever it is, I'd like, ladies and gentlemen, to bring to you Dr. Bulama, who is, I just got a notice here that we have Mr. Garba. Are you the one representing the minister, or you're representing Dr. Faisal? I need to be clear about this.
Yes, it is representation of a representation. The invitation you can see here, it was sent to the minister. And the minister now delegated my chief executive, who passed on the ball to me.
Okay, so you're wearing like triple caps now, yeah? All right, you have the floor. Yes, you have the floor, and I'm sure this is a familiar terrain to you. You're kicking off this vaccine decision and challenges. Where are we as we speak? You have the floor. Over to you.
Yes, thank you very much. Please, may I have an idea of how many minutes I have? Because I have about 40 slides. So if I know how long I will stay, maybe I will do justice to the document.
Please, may I appeal that truly you can't do, you have the maximum of, let's say, to start with 7 to 10 minutes, so that we can have time to have conversation. I know, yeah, wow. But please do what you can with it. Thank you.
Okay, thank you very much. I hope my slides can be seen by all. Yes, so you heard my name, Dr. Abdullahi Bula Magarba. I'm currently Director of Plan Research and Statistics at the headquarters of the National Primary Healthcare Development Agency, and sitting in for my Chief Executive Officer, Dr. Faisal Shuaib, who mandated me to pass on the messages of the Honorable Minister on the subject given to me. Please permit me to stand on a well-established protocol in the interest of time. Therefore, the messages I'm going to communicate here are from my chief executive. So the correct ones are from him. And I will, in advance, seek your apology for some human errors that I may make during the course of the presentation. I learned we don't have time. Otherwise, my presentation would have loved to look at the background of COVID-19 and the responses, the planning platforms, activities involved, the issues around data management, the issue around vaccine logistics and accountability, and then end off with risk communication. But I can see time may not allow me go all that. But all the same, now just by way of introduction, in our response, we started by establishing a multisectorial vaccine introduction technical working group. And that technical working group is the one that strategizes on how vaccines could be deployed, how vaccines could be administered, and how the data could also be collated. And that one too has 4 sub-technical groups. The one that will be looking at the administrative part with service delivery, as well as the data, the vaccine safety, logistics, and then risk communication. And of course, we are interfacing, being that my chief executive is the member of PTF. He goes to the meeting there, he comes with very high level instructions, and then we do the nut and bolt work on how to implement the high level decisions taken at the PTF. So we are all aware that we received 3.9 million doses of AstraZeneca vaccines, and that is just a first tranche out of $16 million doses that were promised to us through COVAX facility. And of course, just 2 days ago, we received an additional 300,000 doses courtesy of MTN, who also pledged to give us 1.5 million doses of COVID-19. And with that, we continued moving. But then the subsequent bullet there will indicate, after resolving the issues around the AstraZeneca vaccine, especially in the EU member countries, are now having certified it very safe. Now, many of those countries are also going for AstraZeneca vaccine. And therefore, the reserve that was left for us was now changed to Johnson & Johnson. So from the initially we were pledged to receive 60 million, but because of this new arrangement, our allocation has now jumped to 29.8 million doses of the vaccines. So now this slide is just talking about the issue to do with AstraZeneca vaccines and then the resolutions, and now it is safe, so I don't have to go through the interest of time. And then, of course, all these are the assurances that are found from the Food and Drugs Administration and the other regulatory bodies, indicating the effectiveness and the efficacy of the vaccines. Now we're talking about 79 vaccine effective, and then 100% effective when it comes to preventing people from falling seriously ill. So now coming to the coordination, I can still remember fresh in me that my auntie Mojima Kenjola and many of the people on this platform attended the launching of our TEACH strategy by the Honorable Minister of Health himself, which is an indigenous approach to COVID-19 vaccination.